Hi, this is Dr. Padma Garvey. A little while ago, I did a post in my blog in the Hudson Valley Parent magazine on recurrent urinary tract infections and vaginal infections. It's a big problem for a lot of women. In the post, I talked about the accumulating scientific evidence linking UTIs and recurrent vaginal infections to the meat that you're eating. A lot of this research came out of McGill University in Canada, but it's been duplicated in various other academic institutions. After I saw this evidence that was published for American physicians in the Center for Disease Control, I started telling my patients who were suffering from recurrent urinary tract infections and recurrent vaginal infections, I encouraged them to stop eating meat, especially poultry. I thought it'd be great to talk to a patient of mine named Carmen who took my advice, and after a year of changing her diet, she had excellent results, and so we're going to listen to what she has to say. So, why don't you tell us a little bit about yourself, whatever you're willing to share as far as your personal information?
Okay, I'm 61 years old, and I just retired, and I've worked for 32 years in a meat department, and I had lots of problems with urinary tract infections. At least once a month, maybe twice, I would have an infection, as you know.
When did the problem really start?
I would say it probably started about 20 years ago, honestly.
Really?
Yeah. I've always had problems with burning and bloatiness or feeling uncomfortable. But I've always worked in a meat department, so I think that had a lot to do with it.
So, starting 20 years ago, what would you do? Would you go to the doctor's office and...
Yes, I was always in the doctor's office, always taking antibiotics.
And when you went, would they take your urine and send it to the lab and make sure it was an infection?
Yes.
And so did the antibiotics help you with these episodes?
Yes, they did. It did help, but they would reoccur again.
Okay. And so when did you really start, thinking, gee, maybe there's something else going on? Like, when did you see a urologist or?
I did. I saw 2 urologists. Okay. One of them, he did what they call dilation. He dilated my urethra, and he would do that almost every 3 months, and it was very painful, and it really didn't help. So I stopped going to him. Then I went to another urologist that he put me on hormones, which was not good because of the side effects.
Were they oral hormones, or were they?
They were both. Both.
Okay.
I had to take both,
okay.
Oral and vaginal. And I did that for a while, but the side effects, I was gaining a lot of weight. I stopped taking them.
Okay.
And then that was when you had suggested that maybe it had something to do with my diet.
Okay.
And I decided I had nothing to lose, so let me stop eating meat, which I did, and it's been a year, and in 1 year I've only had maybe 2 infections, where I used to have an infection almost every month.
Wow. So how soon after, well, let me ask you this. When you decided that you were going to give up meat, did you cut everything out all at once, or did you kind of do it gradually? How did you do it?
Well, I cut out the chicken first, because that was where I think you had suggested to do, and I cut the chicken first, and then I just cut the beef second, little by little. And it's been a year that I've been vegetarian, and I really have no regrets.
Oh, that's good. So since you've made, well, let me ask you this, but were you someone who, would you say that you ate a fair amount of meat before you gave it up, or were you?
Yes. No, I ate meat every day, maybe twice a day.
Mm-hmm.
I would have meat with lunch or meat with dinner. Yeah.
And I'm not sure if people heard, but Carmen worked in the meat department, and so I'm sure, in addition to what you were eating, you were also, exposed to all the meat that you were handling.
Yes. Yes.
So I guess you were tired just at the right time.
Yeah.
So did you notice any other changes, like in addition to the decreased urinary tract infections?
I noticed that I lost a little weight. I guess I did lose a couple of pounds. I did lose some weight. Mm-hmm. And I didn't feel I used to have a lot of problems with my stomach, like digesting. I have no digestion problems. So I do feel that's, and
yeah.
I also had a problem with constipation or not going regular, and once I stopped eating meat and ate more vegetables, which I eat a lot of vegetables, I eat beans, I try to have tofu and things like that to replace the protein.
Yeah.
It's been 100% better.
That's great. So what does your family think about all of this?
I actually have 2 nieces that are now vegan. They're vegan. They don't eat any dairy or anything that has any meat products. They're really amazed because they knew that I was always suffering with that problem of the burning, the having to go all the time to the bathroom. I couldn't go far without making sure that there was a bathroom where I could go to because of the urge.
Right.
So it's been a blessing. I mean, I'm able to do a lot more without having to worry about that problem.
So, what do you do now for breakfast? Like, what's a typical breakfast for you?
A typical breakfast for me would be I would have oatmeal, or I'll have cold cereal or hot cereal, or I might have an egg white omelet with onions and peppers and mushrooms.
Mm-hmm. Yeah, and then what do you do for lunch?
For lunch, I'll usually have pasta. I'll make vegetables, and I'll put a little, like a cup of pasta in the vegetables, and I'll make like a summer salad. And sometimes I'll even put fruit in the salad, and I'll put pasta in it to make it more substance. Mm-hmm. I'll put beans. I mean, I put everything in my salad or my pasta salad. I'll put beans in there. I'll put some pieces of apple, which so it's or I do eat fish. I do have wild salmon at least twice a week. I'll eat wild salmon.
Mm-hmm. And what do you do for dinner?
For dinner, I'll have a piece of salmon. Sometimes I'll have a sweet potato. I'll have rice with beans. I'll have a stew, but made out of beans and vegetables.
Now, you had mentioned that you're eating tofu. Is that something that you had eaten before?
I had tried it before, but I learned how to cook with it, how it picks up the flavor of whatever you put in it.
Right.
So I've learned to use it in my meals.
And were there any good websites or recipe books that you recommend for people who are trying to learn how to cook more?
Actually, I did go to one of your websites where you had a recipe for pasta vazul, which I tried and it was excellent. And I do go like online and I'll look for recipes for pasta, or I'll buy cauliflower, and I learned how to make the mashed potatoes with the cauliflower. So I have used trying to use vegetables more.
And do you find it challenging trying to eat out? Like, what do you do when your family wants to go out to dinner?
I usually, when I go out for dinner, I'll try to not to be too hungry, and it works for me. I try to eat something, maybe if we're going to go out for dinner, I'll have a late lunch. This way I'm not so hungry, so I could just stick to a nice salad, and I'll have a nice sized salad, or I'll have just vegetables, a plate of vegetables. That's without great. Any, and I'm really satisfied with this, the way I'm eating. I feel better. I'm not sluggish. I feel better, and I think I even look better sometimes.
Oh, yeah.
And I'm 61.
No, you look fantastic.
Something is working.
Yeah. Well, that's great. I'm so glad that you shared your experiences, because I think it'll help motivate some people. I mean, a lot of women are suffering from the same problems you had suffered with. So, and when I do mention the connection between meat consumption and urinary tract infections, a lot of people's reactions are like, really?
Yeah, well, I was very skeptical. I mean, I was like, but then I said, what do I have to lose to try it? I'm sick of taking medication. I'm sick of going through what I was going through. So I had really nothing to lose, and I'm glad I made the change.
That's great. That's great. Well, Carmen, I'm so happy that you were able to talk to me today, and I just want to thank you very much.
Thank you, Dr. Garvey.
Okay, take care.
You too. Bye-bye.
I hope you got a lot out of what Carmen had to tell us. As always, you can go to my website, www.drpadmagarvey.com, drpadmagarvey.com, for recipes, cooking videos, podcasts. I also write a weekly blog for the Hudson Valley Parent magazine that you can check out. In addition, I highly recommend watching the video Forks Over Knives. Also, an excellent book to read is The Good Gut and How Not to Die. The music for my podcast was provided by bensound.com. This is Dr. Padma Garvey signing off. Thanks for listening.